Last month, one of my patients called me at midnight. She had a headache that wouldn't go away, and she almost didn't call because she thought she was overreacting. When she came in the next morning, her blood pressure was dangerously high. She had preeclampsia, and if she'd waited another day, things could have gone very wrong. Today, I'm sharing the 7 red flags during pregnancy that mean you need to call your doctor immediately, not tomorrow, not after you Google it, right now. These are the warning signs that could save your life or your baby's life. Hey everyone, I'm Diana and welcome back to Sweet Pregnant. I'm a doctor specializing in women's health, and I've been doing this work for over 9 years now. And here's what I've learned. Pregnant women are often worried about bothering their doctors. They second-guess themselves. They think they're being dramatic or overreacting. But I'm here to tell you something important. It is always better to call and be told everything's fine than to wait and have something serious happen. Your doctor would much rather see you for a false alarm than miss something critical. So today, I'm going through the 7 red flags that should always prompt an immediate call to your healthcare provider. These aren't things to monitor or wait on. These are the symptoms that require action. Let's dive in. Red flag number 1, a severe, persistent headache, especially if it comes with visual changes. I'm not talking about your regular tension headache or the mild headache you get when you're dehydrated. I'm talking about a headache that feels different from anything you've experienced before. A headache that doesn't go away when you rest or take Tylenol, and especially if it comes with seeing spots, blurry vision, or sensitivity to light. This can be a sign of preeclampsia, which is dangerously high blood pressure during pregnancy. Preeclampsia usually develops after 20 weeks, and it can escalate quickly. The patient I mentioned at the beginning? Her headache started on a Tuesday afternoon. By Wednesday morning, her vision was blurry. By the time I saw her Wednesday afternoon, her blood pressure was sky high, and we had to take immediate action. Other symptoms that might come with this: swelling in your hands and face that comes on suddenly, not the gradual ankle swelling that most pregnant women get. I'm talking about waking up and your rings don't fit anymore, or your face looks puffy in a way it didn't yesterday. Pain in your upper right abdomen, right under your ribs. This can indicate liver involvement, which is serious. Nausea or vomiting in the 2nd or 3rd trimester, especially if it's new or suddenly worse. What you should do? Call your doctor immediately. They'll want to check your blood pressure and run some tests. Preeclampsia can progress to eclampsia, which causes seizures, and that's life-threatening for both you and your baby. This is not something to sleep on. This is not something to Google and see if it resolves. This requires immediate medical attention. I cannot stress this enough. A severe headache with visual changes during pregnancy is an emergency. Call your doctor. Go to the hospital if you can't reach them. Don't wait. Red flag number 2, a significant decrease in your baby's movement. Once you start feeling your baby move regularly, usually around 18 to 25 weeks, you get to know their patterns. Some babies are more active in the morning. Some do acrobatics at night. You learn what's normal for your baby. If you notice that your baby is moving significantly less than usual, or if you haven't felt movement in several hours when you normally would, that's a red flag. Here's what I tell my patients. After 28 weeks, try to be aware of your baby's movement patterns. You don't need to obsessively count kicks all day long, but you should notice if things change dramatically. If you're worried, do the kick count test. Lie on your left side in a quiet room and count movements. You should feel at least 10 movements within 2 hours. Kicks, rolls, swishes, all of it counts. If you don't feel 10 movements in 2 hours, or if you just feel like something is off, call your doctor. I had a patient last year who called me because her normally very active baby had been quiet all morning. She felt a little silly calling, she said. Maybe he's just sleeping more today. But she trusted her instincts and called anyway. When she came in, we did a non-stress test and found that the baby's heart rate wasn't responding normally. We discovered that the umbilical cord was compressed and we had to deliver the baby that day. Everything turned out fine because she called when she noticed something was different. Your instincts matter. You know your baby better than anyone. If something feels wrong, don't ignore it. What you should do? Call your doctor. They'll probably have you come in for monitoring. they might do an ultrasound or a non-stress test to check on the baby. Most of the time, everything is fine. Sometimes babies just have quieter days. But it's always worth checking because when it's not fine, catching it early makes all the difference. Red flag number 3, vaginal bleeding, especially in the 2nd or 3rd trimester. Now, spotting in early pregnancy can be normal. Light pink or brown discharge, especially after sex or a pelvic exam, is usually not concerning in the 1st trimester. But bright red bleeding, heavy bleeding, or any bleeding in the 2nd or 3rd trimester needs to be evaluated immediately. This could indicate several things. Placenta previa, where the placenta is covering the cervix. This can cause painless bleeding and requires careful monitoring and usually a C-section delivery. Placental abruption, where the placenta starts separating from the uterine wall before delivery. This is usually accompanied by pain and can be life-threatening for both mother and baby. Preterm labor, especially if the bleeding comes with contractions or pelvic pressure. Or in early pregnancy, it could signal a miscarriage or an ectopic pregnancy. What you should do: call your doctor immediately. If you're bleeding heavily, like soaking through a pad in an hour, or if you're passing clots, go to the emergency room. Don't try to determine on your own whether it's enough bleeding to be concerned about. Any vaginal bleeding beyond light spotting deserves a call to your healthcare provider. They'll want to examine you, possibly do an ultrasound, and monitor both you and the baby. Here's what I tell my patients about bleeding. It's always better to call and be told it's nothing than to wait and have it be something serious. I have never, in my entire career, been annoyed by a patient calling about bleeding during pregnancy. We take it seriously because it can indicate serious complications, so you should take it seriously too. If you're bleeding, lie down, rest, and call your doctor. Don't wait until your next scheduled appointment. Call today. Red flag number 4, severe abdominal pain or cramping. Now, some cramping during pregnancy is normal. Round ligament pain, which feels like a sharp pain in your lower abdomen or groin when you move suddenly, is common and harmless. Gas and bloating can cause discomfort. Braxton Hicks contractions, which are practice contractions, can feel uncomfortable but aren't usually painful. But severe pain, especially if it's constant and doesn't go away when you rest or change positions, needs to be checked out. What I'm talking about: pain that's so intense you can't talk through it or catch your breath. Pain that's localized to one specific area and feels sharp or stabbing. Pain that comes with other symptoms like fever, chills, nausea, or vomiting. Pain in your shoulder, especially the right shoulder, which can indicate internal bleeding. This could be a sign of placental abruption, which I mentioned earlier. This causes severe, constant pain and can be life-threatening. Appendicitis, which doesn't stop happening just because you're pregnant. In fact, it can be harder to diagnose during pregnancy because the appendix shifts position as your uterus grows. Gallbladder problems, which are more common during pregnancy. Preterm labor, especially if the pain is rhythmic and comes in waves. An ectopic pregnancy and early pregnancy, where the fertilized egg implants outside the uterus, usually in a fallopian tube. This is a medical emergency. I had a patient in her 2nd trimester who came in with severe right-sided abdominal pain. Her first thought was that it was just pregnancy discomfort. But the pain got worse over a few hours and she finally called. It turned out to be appendicitis, and we had to do emergency surgery. She told me later that she almost didn't call because she didn't want to seem dramatic. But appendicitis during pregnancy is serious, and waiting could have led to a ruptured appendix, which is extremely dangerous. What you should do: if you have severe abdominal pain, call your doctor right away. Describe where the pain is, how long you've had it, and what it feels like. If the pain is unbearable or comes with heavy bleeding, fever, or vomiting, go to the emergency room. Don't try to tough it out. Don't assume it's just normal pregnancy discomfort. Severe pain is your body's way of telling you something is wrong. Red flag number 5, signs of infection, especially urinary tract infections. UTIs are incredibly common during pregnancy. The hormones and physical changes make pregnant women more susceptible to them. And here's the scary part: if left untreated, a UTI can lead to a kidney infection, which can cause preterm labor. Symptoms of a UTI: burning or pain when you urinate, feeling like you need to urinate constantly, even when you just went, cloudy or strong-smelling urine, pain in your lower abdomen or back. If a UTI progresses to a kidney infection, you might also have fever and chills, nausea and vomiting, pain in your back or side, usually on one side, that's severe and constant. A kidney infection during pregnancy is serious and requires immediate treatment with antibiotics. It can lead to preterm birth or other complications if not treated quickly. Other infections to watch for: flu or fever over 100.4 degrees Fahrenheit. Fever during pregnancy needs to be evaluated because it can affect the baby's development, especially in the first trimester. Any signs of infection and a surgical wound if you've had a procedure or C-section. Group B strep, which is screened for late in pregnancy but can cause serious complications for the baby if not treated during labor. What you should do: if you have symptoms of a UTI, call your doctor. They'll want a urine sample to confirm the infection and will prescribe antibiotics that are safe during pregnancy. If you have a fever, don't just take Tylenol and ignore it. Call your doctor and let them know. They may want to see you to determine the cause. Infections during pregnancy need to be treated promptly. Don't wait it out hoping it'll go away on its own. Red flag number 6, sudden, severe swelling, especially in your face and hands. Now let me be clear. Some swelling during pregnancy is completely normal. Your ankles might swell at the end of the day, especially if you've been standing a lot. That's just fluid retention and increased blood volume. But sudden swelling that comes on quickly, or swelling in your face and hands, can be a sign of preeclampsia. What I mean by sudden: you wake up and your rings won't come off when they fit fine yesterday. Your face looks puffy, especially around your eyes. Your hands feel tight and swollen. The swelling doesn't go down when you elevate your feet or rest. This is different from gradual ankle swelling that develops over weeks. This is a noticeable change in a short period of time. Why this matters: sudden swelling, especially when combined with high blood pressure, headaches, or vision changes, indicates that your body is retaining too much fluid too quickly. This can be a sign that your organs, particularly your kidneys, aren't functioning properly. I remember a patient who came in for her routine appointment, and I noticed her face looked different. She said she'd woken up that morning and her wedding ring wouldn't fit. Her blood pressure was elevated, and we diagnosed preeclampsia. We were able to manage it carefully, but if she'd ignored the swelling and skipped her appointment, it could have become much more serious. What you should do: if you notice sudden severe swelling, especially in your hands and face, call your doctor. They'll want to check your blood pressure and urine for protein. Monitor your symptoms. If the swelling comes with a headache, vision changes, or abdominal pain, it's even more urgent. Most swelling during pregnancy is normal and harmless. But sudden, severe swelling needs to be evaluated. Red flag number 7, severe pain in one leg, especially if it's swollen, red, or warm to the touch. This could be a sign of a deep vein thrombosis, or DVT, which is a blood clot in a deep vein, usually in the leg. Pregnancy makes you more susceptible to blood clots because of hormonal changes and because the growing uterus can put pressure on the veins in your pelvis and legs, slowing blood flow. Symptoms of a DVT: pain in one leg, usually the calf or thigh, that feels like a cramp or soreness but doesn't go away. Swelling in one leg. Not both legs. One leg that's noticeably more swollen than the other. Warmth or redness in the affected area. The pain gets worse when you walk or stand. Why this is so serious: if a blood clot breaks free from your leg, it can travel to your lungs and cause a pulmonary embolism, which is life-threatening. A pulmonary embolism blocks blood flow in the lungs and can be fatal if not treated immediately. Symptoms of a pulmonary embolism include sudden shortness of breath, chest pain that's worse when you breathe deeply, rapid heart rate, and coughing up blood. If you have any of these symptoms, call 911. Don't drive yourself to the hospital. This is a medical emergency. What you should do: if you have pain and swelling in one leg, call your doctor immediately. They'll likely want to do an ultrasound to check for a clot. If a DVT is found, you'll be treated with blood thinners that are safe during pregnancy to prevent the clot from getting bigger or breaking loose. Don't massage the area or try to stretch it out. If there's a clot, you don't want to dislodge it. And please, don't ignore leg pain during pregnancy. I know pregnancy causes all kinds of aches and pains, but one-sided leg pain with swelling is different. It needs to be evaluated. So those are the 7 red flags: severe headache with visual changes, decreased fetal movement, vaginal bleeding, severe abdominal pain, signs of infection, especially UTIs, sudden severe swelling in your face and hands, pain and swelling in one leg. Here's what I want you to remember. You are not overreacting by calling your doctor about these symptoms. You are not bothering them. You are not being dramatic. These are legitimate warning signs that require medical evaluation, and catching these problems early can make all the difference for you and your baby. I have never met a doctor or midwife who was annoyed by a patient calling about a potential emergency. Never. We want you to call. We want to check on you. That's literally our job. So please, trust your instincts. If something feels wrong, call. If you're experiencing any of these red flags, don't wait. Your health and your baby's health are too important to second-guess yourself. If this video helped you understand what to watch for, hit that subscribe button. My next video is about what actually happens during labor, hour by hour. No Hollywood drama, just the real timeline so you know what to expect. Drop a comment if you've experienced any of these red flags and let me know what happened. Your story might help another mom-to-be. Take care of yourself, listen to your body, and don't hesitate to reach out to your healthcare provider when something doesn't feel right. I'll see you in the next one.